welcome back to Dr. Noah's Update. And so what's been going on in the news, definitely on the internet, is this big kind of scandal, which is still, it's a scandal. So in pharmacy, what's happened over the last 100 years is back in the turn of the 20th century, there pharmacists, once again with drugs, were what are called compounding pharmacists. They would actually create the pills and the drugs. They would take the raw ingredients and make something like that. Well, over time, that was shown, once again, you couldn't have a kind of monopoly on it. You couldn't make as much money, and so we've gone away from that. And now you go to big box, drug stores, Walgreens, CVS out here in California, and I'm sure there's different places like that. You go to Costco, you go to Sam's Club, Walmart, you go to grocery stores. They all have a pharmacy there. They take a big bottle from the drug company, they put it into a little bottle, and it's really kind of a sad thing. Pharmacists, he or she's, are really the expert of drugs and all the bad things, because they have to spend 4 or more years on just the chemistry, where drug doctors spend like 1 or 2 semesters, and now they just get their information from the drug reps. All they do is they take them, and I've talked to them. Oh yeah, especially the old timers. Yeah, used to be kind of fun. I'd get a prescription because Mrs. Jones needed a little extra this and that, and so they would actually create these compounds, ointments and stuff. Now they just open up jars, pour, once again, big jars of pills and capsules into little kind of containers like that. So it's pretty much almost like a brain dead job. But anyway, that's where it's going. So anyway, back to the story here is that over the last 43 days there was a compounding pharmacy in Massachusetts that started to kind of really get into doing a lot more than just doing custom stuff. They made custom compounding formulas, but then they started to make it like a mass production like that. And they contaminated their product and happened to be for steroid injections for pain and stuff. Now, so we've already talked a little bit about the politics of trying to eliminate compounding pharmacies. That's kind of a sad story there. The second thing is, even if the compounding pharmacy are allowed to go in, what are they doing with this quackery? There's 4 scientific studies that doing injections for your knee, your hip, your shoulder is quackery. Spinal injections worthless for chronic pain. Johns Hopkins University School of Medicine. They know this is crap. Once again, it costs $800 to $1,300 for procedures, so people make money, and that's kind of good. Here's another study. This was a randomized trial study from Yale. Epidural steroids and saline and subacute sciatica. Multi-center randomized control. No difference if they do a placebo, saline in there, or they put a steroid in there. Worthless. But people are always running, oh yeah, I got back pain, my shoulder, I'm going to go get a steroid problem. Well, unfortunately, this is only from Mayo Clinic. What are the dangers of cortisone shots? This is the fun one I like. Death of nearby bone, so it can cause osteonecrosis. That's kind of good. So you go in, destroys your bone. Joint infection, even if it's pure and stuff. Nerve damage. Skin and tissue thinning, so once again makes your skin age faster. Temporarily flare the pain and joint inflammation. Yeah, that's the most common thing. Yeah, I went in there and now it's killing me. It was a 5, now it's a 10. Boy, I wish I could have a job where it makes you more pain, make $1,300, and it's only quackery. Weakening of tissue. Nice. So maybe that's why it was hurt to begin with. Now it's going to be even weakened, and guess what happens all the time, I say. They do the injection, doesn't work. Oh, now, Mrs. Jones, we have to do surgery. So it's not $1,300 that I made. I'm going to send him down to Mary, the orthopedist, and now she's going to make $15,000. What a deal. Good. They go see me, do some quackery, witchcraft, and now my friend, the orthopedic surgeon, can do their surgery for another $15,000. Osteoporosis, oh, that's a good deal. And so that's the kind of crap that's out there. One is. Now the other issue is that, okay, 40 people have died of complications of meningitis, serious type of problems. Just shows you, once again, you have to be careful what's going on. But in the same amount of time that they want to now ban compounding pharmacy, not allowing this to happen, in the same amount of time, all you good people out there running to your drug doctor, getting your Motrin and Aleve and different types of crappy, what are called non-steroidal anti-inflammatories that we talked about. 7,128 people died versus, once again, 40 people. So what's more dangerous? Having, once again, contamination of steroid injections that kill people, cause all this kind of problems. It's been shown in 4 scientific studies to be quackery, or the crap that you buy that we've talked about. The non-steroidal anti-inflammatories kill more people than all the soldiers that died in 11 years of the Vietnam War. Yeah, that's a good deal. Let's see. Here's a little bit better one. This was in PLOS Medicine, November 2012. Exercising 2.5 hours per week increases your life expectancy by 3.4 years. So for every hour that you exercise, gives you an extra year of not only how long you live, but also the quality of life. So exercise is an important part of good health. You got to move, you got to exercise. That's just how it is. If you don't, forget about it. The top 10 foods that prevent breast cancer, so little positive type things. We have flaxseed. This is from the World Health Organization. Brazil nuts, garlic, pomegranate, green leafy vegetables, salmon, broccoli, green tea, peppers, and turmeric. Now, we can go in another time about foods once again, are thousands of different kind of chemicals, and those chemicals have benefits like that, just like drugs. So by using natural type of foods, you can once again prevent very, very serious problems, as we've talked about. Preventing breast cancer easily, 70 to 90% of all breast cancer can be prevented, but you have to be proactive years before, since it takes decades to happen. So that's it for this week, and we'll talk to you next time.